My name is Alexandra Acuna, and this is my PowerPoint on Sentinel event analysis. The two selected system failures that I chose from the article Lesson from Colorado Beyond Blaming Individuals were non-standard method of writing the drug order and insufficient drug information and inadequate drug references. The lack of the non-standard method of writing the drug order resulted in an order written for Miguel of benzathine penicillin G 150,000 units IM. The physician's method of writing the order was unusual. Benzathine was capitalized and placed on the line above penicillin G rather than after it on the same line. Also, IM appeared to be written over and looked somewhat like IV. The units was abbreviated as just U as well, which could easily be misread as one or two additional zeros. Insufficient drug information could be detrimental. In this case, the pharmacist was unfamiliar with the treatment for congenital syphilis and also had limited knowledge about this rarely used non-formulary drug. Without a pediatric pharmacist on staff, she consulted with the health department's recommendation and drug facts and comparisons to determine the infant dosage of penicillin G benzathine, and she misread both calculations. There was no maximum dose warning. Therefore, when the pharmacist entered the tenfold overdose into the computer, the system didn't issue any warnings about exceeding the maximum dose for the neonate. The primary care provider and the nurse practitioner consulted with three different resources for this medication. The first was a 1994 Red Book report of the Committee on Infectious Diseases to research the treatment of congenital syphilis. One drug recommended to treat congenital syphilis with the penicillin G benzathine IM. However, in this specific text, there was no warning that the drug could be administered IM only. The second resource looked up was Neofax 95. In this resource, one of the medication resources the two nurses used to determine if the penicillin G benzathine could be administered IV. Nowhere in the two-page monogram was penicillin G benzathine mentioned. Therefore, no warnings regarding IM use only were present. The third resource looked up was the NICU medication administration, but penicillin G benzathine was not mentioned there either. So precautions necessary to avoid repetition would be writing everything out in full, writing clear and legibly, not using abbreviations, and having up-to-date available resources for the staff. There are several disciplines in which precautions could emerge. Nursing would be one of them, as well as physicians when writing prescriptions and following that full, clear, legible, no abbreviations. Pharmacy would be another one with resources and being able to, check medications correctly and following that policy or a rule. Medicine would also be another discipline, having the label with the max dosage and any kind of warning labels that could help prevent something like this from happening again. I did find some articles that show research being done to improve these errors. One article showed that errors in prescription writing may be caused by unintentional slips, inattention, poor communications, inaccurate transcription, or unsigned or illegible prescriptions. This is often because the prescriber did not adhere to or apply to relevant rules. Other research being done by the CDC is um, aimed towards health literacy and coming up with plans and actions to help improve health literacy. Some examples of the CDC's acts and plans to helping with health literacy include the National Action Plan to Improve Health Literacy, which is define a blueprint for efforts to improve health literacy. Organizational attributes, learning what your organization can do to lower barriers for people to get and use health information and services. Developing an organizational plan, so finding step-by-step guidance on how to develop a coordinated and strategic plan to improve health literacy at the organization. And the CDC Action Plan. This is learning what the CDC is doing to improve how we create and share health information and provide public health service to different audiences. So the article I found recommended some prescription writing standards. The first would be that all prescriptions should include the drug name, dose, route, and frequency. Prescriptions should be written legibly in ink or, if possible, should be printed using a computer. The drug names and formulas should be written fully without the use of abbreviations. The name of the medicine should be written clearly. Quantities of 1 gram or more should be written in grams, such as 2 gram. Quantities less than 1 gram should be written in milligrams, like writing 500 milligrams and not 0.5 grams. Quantities less than 1 gram or 1 milligram should be written in micrograms, such as 100 micrograms instead of 0.1 milligrams. When decimals are unavoidable, a 0 should be written in front of the decimal point where there is no other figure, so 0.5 milliliters and not 0.5 milliliters. The use of the decimal point is acceptable to express a range, like 0.5 to 1 gram. Micrograms and nanograms should not be abbreviated, like units should not be abbreviated with just the U. Calculations should be double-checked, and the completed prescription should be reread to ensure that it is correct and legible. So basically, we can see that medication errors are going to occur. There are steps that can be taken to help prevent medication errors. Research is being done constantly to reduce medication errors, and recommendations are out there. Many hospitals have policies that we need to follow to prevent these medication errors. Unfortunately, medication errors do occur, but we need to be aware and utilize our resources around us in order to prevent medication errors. And this is my reference slide.